Ashok, you work in Delhi, so your pressure may be at a different level. Do you think working in Delhi with a different set of politicians and celebrities, how is your experience with managing these celebrities? Because I think youngsters, I'm always scared, as Matthew said, because when things go wrong, it really reflects on you, and it can really be it can make or break your career for some people when things go well or bad. So being in Delhi, do you feel is different from being in another city, or how is your experience with dealing with these super VIPs?
So you asked a very difficult question, but it actually affects all of us in some way or the other. See, for example, a young interventional cardiologist working in a small city may get the VIP of that city itself, who would actually be the most important person. And then all eyes are on that young interventional cardiologist. It happens in other cities. It can happen to everybody. And then, of course, on a bigger scale, it happens to us in metro cities, and we actually meet a lot of VIPs. But the way to approach this always has been, is to be just focused and blinkered, because you're not doing a procedure on a VIP, you're doing it on a patient. You do not look at the implications. You always believe in yourself because you've done it before umpteen times and multiple times. And you secure yourself in the belief of, firstly, having done it multiple times before. Secondly, making sure that all systems are into place, like call it the checklist manifesto. And finally, trusting God, because He's willed it for you at the end of the day. And I sort of have a strong trust in God, because none of my patients would get better if I didn't have that belief in God. For example, I want to tell this to the youngsters. You do 100 patients, and there's a one who actually has a perforation, but you did that same thing multiple times and you still get a perforation. This happens to all of us, and therefore you believe in Him to take you on the right path and never give up that belief. That is the recipe for success, and I can define that. Jimmy, I actually wanted to say that doesn't bother me so much. Believe you me. It's only because it doesn't bother me so much because of these two things which I've said. And I just leave it to God and say, my hands, my skills, I've been through it before. I'm not looking at who he is. I'm looking at him as a patient. Tomorrow there'll be a similar patient with exactly the same circumstances, and I'll do the same. Two things in my life which have changed me has been non-professional related. Of course, in a professional manner, I would say, it's when I did my dad's angioplasty at the age of 86. Multi-vessel disease, and thank God, he's at the age of 98 and still doing well. That was the toughest moment of life because I had to rotablate multiple complex lesions and then stent him. And it was a prolonged procedure. I had to be sure of the diet, to be sure of many things. And when you're doing it to your own patient, there's only so much blinkered you can be. That's one time. VIPs doesn't worry me. Once it's your own dad or your own mom you're doing it, that's the toughest, because then you can't think of them as a patient. But I did. I blinkered myself, had every system into place. The only thing which happened right at the end of the procedure, I perk closed him. The perk close slipped. It was my fault because I was just so, suddenly the weight had come on of a successful procedure that suddenly the implications of what could have happened during the procedure struck me so badly that I slipped on that perk close and I pressed his groin for the next 4 hours as he was anticoagulated, but luckily no complication occurred. And the one thing in my life which has transformed, and by the way, my dad is doing very well and thankfully so. So that's one procedure that I will always remember throughout my life as the most defining procedure in my life.